This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia, and I'm going to discuss whether or not ketamine therapy is right for me. So what exactly does ketamine therapy treat? Well, there's a wide variety of mental health illnesses treated by ketamine therapy. More importantly, depression, initial depression treatment, treatment-resistant depression, bipolar depression, suicidal ideations, obsessive-compulsive disorder, anxiety, existential crisis, and end-of-life grief, certain addictions such as alcohol use disorder and cocaine use disorder in combination with traditional treatments, adolescent depression, post-traumatic stress disorder, and specific chronic pain conditions such as neuropathies, CRPS, and headache disorders such as specific migraines and things like trigeminal neuralgia, post-herpetic neuralgia, and several other conditions. So am I a candidate for ketamine therapy? And ketamine therapy can certainly provide rapid relief and remission in up to 70% of treatment-resistant patients in a short period of time, especially when intravenous ketamine therapy is used. Generally, 6 or more infusions are needed, up to 3 times a week, with periodic booster infusions. You have to remember, this is a treatment, not a cure. And so periodic uptake would be needed to maintain the efficacy. Now, results can last variable periods of time, and some people get remission and they can come in and out of the program, but others require maintenance. Now, ketamine does lubricate the psychotherapy process, and that really extends the ketamine therapy results. So it's important to include psychotherapy with your ketamine treatments. Of course, you may have had a bad results in the past with psychotherapy. However, ketamine allows you to basically become a little less rigid in your thinking and have more psychological flexibility. This allows you to consider new opportunities of learning during the therapy process. So what exactly is needed to get ketamine therapy? Well, you need to have a specific medical clearance if you have the following conditions. Schizophrenia. Now, that would be one which, generally speaking, we would not use ketamine therapies for. If you have active heart disease, uncontrolled hypertension, uncontrolled diabetes, dialysis or significant kidney disease, emphysema requiring oxygen, pregnancy, cirrhosis, recent stroke, and relatively speaking, problematic issues include glaucoma or increased intracranial hypertension. Generally speaking, a lot of individuals have hypertension or diabetes, and those are relatively well controlled with medications. Those individuals are generally clear for receiving ketamine therapy because it's extremely safe from a cardiovascular perspective. And the doses that we use both in the IV formulations and the at-home formulations are extremely low, and relative to anesthetic dosings are a fraction of those doses. So again, a lot of times these types of conditions can be screened for at the initial intake call and during the initial intake session. Now, how exactly do I start ketamine therapy? Well, if you're not in the DMV area, the DC, Maryland, Virginia area, certainly contact the local provider and you can have a conversation with them. But certainly at Nova Health, we'd be glad to briefly discuss your situation and determine if this treatment is right for you. Now, we generally arrange an in-office consultation to discuss your mental health journey, preparations for ketamine infusions or home ketamine therapies, the risk and benefits of ketamine treatment, how to integrate your experiences and what you learned during the infusions, and also how to use integrative health and psychiatric options to maximize your outcomes. We can arrange follow-up treatments. We can arrange follow-up therapy sessions with specific specialists, as well as other necessary medical needs that some individuals are found to have during the whole intake process. We generally at Nova Health can provide infusion therapy the same day that you come in for that initial consultation, unless it's determined that the particular treatment isn't right for you. But generally speaking, we usually use our initial phone conversations as kind of the anchor to determine whether or not the person would fit with ketamine therapies. But during the whole discussion and the in-office consultation, from time to time it becomes determined that maybe the individual may have other options that may work better for them. Now, at-home ketamine therapy can certainly be prescribed for those who choose that route at that time. Now, just as a general note, IV or intravenous ketamine can produce more rapid remission in treatment-resistant patients, and it can produce faster results than home-based therapies. So the treatment process for Nova Health is, again, step one, just determine if the condition is treatable with ketamine. If it is, then we certainly would move forward with further conversation. So if you have depression, anxiety, PTSD, suicidal ideations, OCD, bipolar depression, adolescent depression, painful conditions, and specific addictions, then we would look to see whether or not you are medically able to receive the treatment. Now, if there's any medical issues that would interfere with treatment, such as the ones listed here, then we would have to either get medical clearance or clear you at Nova Health Recovery. And then we do, again, on step 3, your medical intake and mental health preparation session, which, again, as we described earlier, we discuss everything from your mental health journey to expectations and then follow-up treatments that would be expected as well. And we discuss how ketamine works and the neurobiology of your condition. And then we also consider additional medical treatments, integrative treatment options, and lifestyle discussions as well. And we'll address addiction and obesity related issues if those are issues for you. And then we start your ketamine therapy process. Generally speaking, the initial treatments through an intravenous route are 0.5 milligrams per kilogram done over 40 minutes, 2 to 3 times per week. And generally, we don't have people go more than several days between infusions. It's generally twice a week or 3 times a week, like on a Monday, Wednesday, and Friday. So an individual who's doing 6 infusions would be done effectively in 2 weeks. It is important to know you have to have a driver or an Uber ride to get home. And then aftercare would include basically using home-based or at-home oral and nasal spray ketamine for maintenance. And then also we consider individuals have a therapist to follow up on integrating their experiences and also the newfound cognitive flexibility that individuals may achieve during these ketamine treatments. Booster infusions can occur at any point in time, generally 2 to 4 weeks after the first set of infusions are completed. And then we monitor lifestyle changes, make adjustments in medications, and of course, encourage self-monitoring and journaling. For the home-based therapy, again, we follow a very similar route. In addition to that, we do require an in-office visit for the first prescriptions, and we have the individual fill out mental health questions and sign the appropriate consent forms and consider integration treatments with their therapist and how they can make ketamine therapy at home work better. Now, the one thing about home ketamine therapy, whether it's nasal spray or oral, is to recognize that it works slower and is less likely to produce remission, but rather give relief from depression and mood disorders. We frequently use lower and moderate doses for patients with mood disorders and sometimes higher doses for patients with chronic painful conditions.